South Africa benefited from gold in the 80s, but we are paying dearly now.
The majority of people who live in Africa have been exposed to TB, but those who have been infected, the TB is dormant in their lungs, and there are some conditions that could activate TB.
People who are working in the mines are 7 times more likely to have TB than the rest of the population.
It's the responsibility of the mine to see that their employees are healthy.
Keeping people healthy, basically, has been a huge challenge.
I know that where we call the plastic fumes, that's really affect my chest.
The dust that comes secondary to the mining activity, which then gets breathed in, and over time causes lung diseases.
Gold mines produce more silica dust than any other mine, any other mineral. So more people from the gold mines are suffering from TB.
WHO policy is that all TB patients should be afforded a HIV test.
TB, HIV are the two that goes together. If you don't manage HIV correctly, TB will get you.
You see, living in the mine without a wife, it was a difficult task. And those people from Pakistan were very much attractive.
If you have got both HIV and silicosis at the same time from the mines, and many mine workers have got both, if you have got both, your chance of getting TB is 1,800%.
Mine workers live in overcrowded conditions and also work in very overcrowded space.
There are two main. If somebody has got TB, then it's easier for you to get TB.
We have actually started a project to reduce the number of occupancies per room.
A lot of people have been working in South Africa since time immemorial, and in the mines they contracted this disease, which then ends up spreading even to the members of their families.
The government of South Africa requested World Bank for support, and the first thing we did was to generate evidence to show the magnitude of the problem, and then use that information to mobilize ministers of health, ministers of minerals, other stakeholders, and collectively a recommendation was made that this was so important that should be discussed at the SADC Heads of State meeting, and the Heads of State declared TB as a regional emergency, and that unlocked significant resources that now we are using to tackle the problem.
It's been very difficult trying to build relationships, trying to build consensus, trying to find middle ground, trying to negotiate.
The affair and the task that we have is not a difficult one. It's not a difficult one at all, technically speaking. But I think in order to achieve that, we all need to give up something.
This program is so important that if we get things right, we are actually unlocking a lot of capital, a lot of money going into the hands of people, especially the poor people, and those unclaimed benefits.
When we started in 2010, we had two sources of funding. We had $50 from the World Bank and $80 from the Department of Minerals.
I think the World Bank's role in that also been, apart from being a funding partner to this, has also had a significant degree of vision in pulling the various partners together. But as we all know, nothing happens without funding.
And we're also hoping that the additional $30 million that we will be putting into this regional program over the next few years will effectively be catalytic.
I feel that the launch of this grant is going to resolve thousands of problems.
Working with other partners in a public-private partnership can yield good results.
We have worked together with the Global Fund and the World Bank to try and coordinate our activities.
Ensuring that ex-miners do get to be attended to with regard to their health.
We have to be more proactive in providing care to people in a more active way, looking for cases.
Getting that benefit medical examination to where they live is something that has not been traditionally done. Mine workers were expected to come to Johannesburg and seek their examination and then hopefully expect some compensation.
People don't have to travel
the services must go to them, because otherwise many of them won't find their way back into South Africa, either because of ill health or because of old age or because of their financial circumstances.
Mine workers, especially black mine workers, have to be compensated better.
In this database, the current database that the MBOD through the Department of Health, we have about 103 as those that we can say they can be traced, and out of those, only 64 were paid.
We owe you money. Because of the prevalence of TB in the mines, yeah, we owe you money.
So as Commissioner for Compensation in the South African Department of Health, the approach we had to take was that we have some very rigorous criteria for what is a compensable illness. We're beginning now the process of a better health service and claims management system in country, as opposed to people coming to Johannesburg.
The TIMS PMO, which falls under WHC, has spent the last 6 months with very detailed planning.
LiveMoya was recently contracted by the World Bank to conduct a social mobilization campaign.
Quite recently, we started on tracking and tracing, which is more on registration of miners to come up with a database.
There should be an extension to our tracking and tracing program to provide financial education so that the money is better managed in order to benefit the family as a whole.
This is very humbling that you can put everything together and a one-stop shop where you have doctors, nurses, technicians, and the clients that we serve. Instead of them going from hospital, knocking at this door, everything is here together today.
We have the hope that we will get funding where we will build hospitals.
Then I'm happy to announce that since that period, 11 other centers are going to be built with money from Global Fund in the SADC region of South Africa.
People feel that there is hope after all these years of not getting what they've been working for in all these years.
I'm happy today that things are promising.
I believe that we will not only defeat TB, but we are committing ourselves to extinguish TB. TB, we are coming to you.